Are you saying that it is wrong to hold the baby upside down and slap them?
Absolutely unnecessary. You know that there are many babies that are labeled as stillbirth and they are put away while their hearts are still breathing.
Come again?
No amount of Holy Ghost fire will be enough to get that baby breathing. Nigeria has the second highest infant mortality rate in the world.
Children are still dying of diseases that are completely preventable, from poor nutrition, diseases, inadequacy, lack of hospital materials, syringes, oxygen, vaccines, and even something as simple as ambu bag.
Everybody in this country needs to know what an ambu bag is. Government has to be the quarterback of healthcare. Over 260,000 babies die in Nigeria every year. 700 babies every day. Why do these babies die?
So we'll just go straight into it. Nigeria still has one of the highest mortality rates in the world. And a lot of these deaths were not caused by accidents. They were caused by neglect, were caused by diseases, were caused by malnutrition, and a couple of other things. Do you have the story of a child who died that shouldn't have died simply because the system around them failed them?
Do I have a story? Do I have a story? So then I will ask you, how much time do you have? Abundant stories. Abundant stories that should not be. Abundant stories that should not be. To be very clear, Nigeria has the second highest infant mortality rate in the world. Second highest infant mortality rate. About over 260,000 babies die in Nigeria every year. That translates to 700 babies every day.
Wow.
In Nigeria, this country, more than 700 babies die every single day. Let's just establish that. So after this conversation today, by the time we wake up tomorrow, another 700 have gone. I tell people to just imagine two Boeing 747 jets crashing every single day. And we come out day to day, oh, another two crash, oh, okay. Next day, oh, okay. That's what we're doing. Why do these babies die? Many reasons, especially three. Number one is my pet peeve, birth asphyxia. And I'll come to that, about what that means. Number two, prematurity, a baby born too early. Number three, infections. Birth asphyxia. You know, doctors like to use big grammar, you understand? Asphyxia. Bottom line, inability to breathe. You can't breathe.
After they're born.
After they're born. You can't breathe. Most people, I know we don't really think about it that way. A baby doesn't breathe inside the mother. Okay? Why do we breathe? We breathe because that is how our lungs get oxygen from the air. Okay? Oxygen comes in through your lungs. That thing, Yoruba people call it fuku. That we like to eat. Powerful organ. Gets oxygen in, and then the oxygen diffuses. The oxygen enters your blood. Then, of course, Mr. Heart pumps that around, right? So all that process, a baby doesn't need it while the baby is inside.
The womb, yeah?
Because that thing they call a placenta. The placenta is there. So the placenta is the distributor. Just gets that nice blood that has oxygen in it.
Nutrients, everything.
Everything, all the nice things. And placenta, through the placenta and that umbilical cord, through your navel, baby gets the supply. But now baby is born. So baby does that for 9 months inside the womb. Okay, playing inside the womb, amniotic fluid, me and my mama day, belly they swell, everybody they happy. Mama Dorcas, hey. I'm going to tell you about Mama Dorcas in a minute. But anyway, now the baby is born. When the baby is born, the baby now needs to breathe.
On their own.
On their own. Just like if, when you're growing up, your parents take care of you and all that. And I say, Chinon, so you don't grow now. You're a man now. You need to take care of yourself. Now the baby has to breathe on its own. And as we say, now there's sometimes yawa the gas. Sometimes the baby cannot breathe on their own. And what is required is that we have to help that baby breathe. Help that baby breathe. What does that look like? So baby is born. If the baby is not breathing, very simple, at least to those who know. Sometimes there can be liquid, fluids. I don't want to use medical jargon. Fluids in the baby's mouth, in the baby's nose. So the provider needs to remove the fluids.
Yeah.
They remove the fluid. Also, the baby needs to be stimulated. How do you stimulate the baby? Simple way. You get a clean cloth because baby comes out wet. You get a clean cloth in wiping the baby dry. And through that process, you are stimulating the baby. Unfortunately, though, there are many places where they still spank a baby.
Hold
the baby upside down, so they spank
hold the baby and slap the baby.
Slap you black and blue.
Why did they do that?
Because that was the way of stimulation. So if you stimulate a baby, so not breathing is what we doctors call apnea.
Yeah.
Cessation of breathing, apnea, not breathing. APNEA, apnea. If you are not breathing and we're able to stimulate you
by simply just rubbing a cloth?
Yes. And you start breathing, that works if you're in primary apnea.
Okay.
Because there are two stages of apnea. Primary apnea, secondary apnea. If you are stimulated, you start breathing, primary apnea, no big deal.
Yeah.
But sometimes babies enter secondary apnea. In secondary apnea, no amount of stimulation will be enough to get that baby breathing.
So you're trying to say that when a baby has secondary apnea, there's no amount of slap, no amount of turning upside down that will make the baby breathe?
No amount of Holy Ghost fire.
Okay. So how can that be corrected?
So a baby in secondary apnea needs to be helped to breathe by using a bag and mask, what we call the ambu bag. Everybody in this country needs to know what an ambu bag is and what an ambu bag looks like.
Okay.
Because that is a simple, powerful device. Powerful device. So now, using the ambu bag with what we call a face mask, I put it on the baby's face, cover the nose and the mouth. And it has to have the right size. Usually 2 sizes for the babies that are full-term grown. If it's premature, a smaller one. Put it on the baby's face and they squeeze that bag and help the baby breathe. There's something called the golden minute. The golden minute. The premise of the golden minute is this, is that within 1 minute that a baby is born, 60 seconds, if the baby is not breathing on their own, then somebody must be there who can help that baby breathe. And that is the crux of the matter. That is where our problem lies.
What happens?
Many of our providers are not adequately trained, adequately knowledgeable, adequately equipped, adequately supported. A skilled provider, and that is part of what we push. I represent an organization called For Breath for Life. And for many years now, we have been training healthcare providers across the length and breadth of this country on this fundamental thing. A skilled provider needs to be present at the birth of every baby everywhere. Ladies and gentlemen, we must know, the public needs to be aware. We need to plan. Anticipation. We have to plan for a delivery. We plan for so many things.
Mm-hmm.
And then we take delivery for granted. There's a saying in one of our local languages, and our local languages are important, by the way, in the sense that there's too much grammar, too much English in the things that we're doing.
Mm-hmm.
English is not my mother tongue. We need to be breaking down medical information into our local languages. As many of the languages as possible, and then Pidgin.
So Pidgin is actually very powerful.
Let me give you a story now. They say, Mama Dorcas now, wow. Mama Ngozi. They say you don't get belly again. Congratulations. When you go come born this baby now? Now boy have been a girl. I don't know. The baby go soon come. Now don't ready. Where you go born your pikin now? I never know. Mama Dorcas no born your pikin anywhere. Pikin them they die. Mama said they die when they born them. You don't know what to do, Mama Ngozi. It no easy. She born pikin finish, now pikin, blood everywhere. Blood just they do twet everywhere. If you want born your pikin, go where they know waiting, then they do. When you ask them question, no. If your baby no bleed when they born them, then sabi waiting then go do. If you begin bleed yourself, then sabi waiting then go do. If baby no fit come out and you need operation, waiting go happen. Now suppose plan am. Oga don't get him money because they say to do operation, that's in money plenty. Not be the time where operation they already say Oga go find money. The money supposed done ready before you born your pikin. And they tell you, not be small thing. And then baby themselves, they fit get jaundice. You know what they call jaundice? When baby go turn yellow. Not be yellow fever. Baby fit get jaundice. And they say that jaundice, they spoil baby brain. All of these things, they get to check and well. Me all our pikin not just they die anyhow. We get to shine our eye. Not be so like before we go, they do, Mama Dorcas. I beg you, I don't want to hear rubbish.
And that's actually more locally relevant than somebody who just sits down with a patient and say, oh, Mama Dorcas, what week are you in right now? We need to learn how to communicate, especially as medical professionals.
Absolutely.
Understand where you are, understand the peculiarities of where you are, and try and fit whatever knowledge you have. And that's, for me, that's the major sign of intelligence. You can't call me intelligent simply because I'm able to rattle off facts from a book.
Or you're speaking big grammar like some politicians.
Exactly. You call me intelligent because I'm able to still take that big information and break it down so that everybody at every single level gets it. And I'm pretty sure that that's, what you're doing with For Breath for Life.
Breath for Life.
But if we go back to the conversation about the infant mortality, especially the golden minutes, I just want to reiterate something. Are you saying that it is wrong to hold the baby upside down and slap them?
Absolutely unnecessary.
You don't need to do that.
Absolutely not.
I was at a primary healthcare center somewhere in the northern part of Nigeria. And I noticed that this hospital did not have an ambu bag. And you mentioned right here that an ambu bag is one of the most important, as a matter of fact, one of the most powerful resuscitators, if we use that word. If a baby is between life and death, most times an ambu bag gives them a chance at life. What chance would you say a child born in that particular hospital has at life? Let's just say they have secondary apnea.
If they have secondary apnea, and they cannot help that baby breathe, that baby would die. But interestingly though, because those babies don't breathe inside the womb, they actually are quite resilient.
Mm-hmm.
It actually takes a while for the baby to die. Okay? Even though the baby is not breathing, the baby is still alive. because the heart is still beating.
Yeah.
Because the heart is still beating, if you can resuscitate that baby will survive and be just fine. But also, it's important for the time not breathing, the apneic period, what we call it. It's important for it not to be too long.
I was asking.
Because if it's too long,
what happens?
It now damages the brain permanently. But I'll say something about what you were saying earlier.
Let me be sure I understand what you're saying. A baby is born, struggling to breathe. After a particular period, the baby's brain is damaged.
Permanently.
And it's permanent.
Permanently. Let me do small, big English. Hypoxic, ischemic, encephalopathy. Hypoxic, meaning no oxygen, very low oxygen. Ischemic, meaning no blood. Encephalopathy, brain damage. So brain damage due to a lack of blood and oxygen flowing through the brain adequately. But here's this crazy thing. Do you know that there are many babies that are labeled as stillbirth and they are put away while their hearts are still breathing?
Come again? Are you saying that there are many babies who have been labeled dead, but their hearts are still beating?
Yes, sir.
In this country?
Absolutely. And one of the things we want to track with the work we're doing with our partners is looking at stillbirth rates. So that we know certainly that the more efficient the standard of care, the medical practice is in that area, that stillbirth rate will reduce. And data is one of our problems. By doing all this stuff about 700 and all that, we believe it's way higher than that. Because there are many places where births are not even recorded. There are many babies that are born in this country. Nobody say, they are not even known. They're not even known. The system is not aware that you are here.
Wow. Let's go back. Do you think that Nigeria has a way that it doesn't regard life? Because, you mentioned...
No, this one they say, Abi, they whine me.
Do you think we've normalized child deaths or infant deaths in a very dangerous way?
So, okay, you and I are medical doctors, right? I think that there's a peculiar way that human beings manage to disconnect from very troubling circumstances. It's almost like some kind of protective mechanism to help you manage a very difficult, ugly reality so you can still continue to function. Now, in this country, what is the value of a human life? Now, how much we value life is depicted not in our words, not in promises,
I see where you're
but in our actions.
I see where you're going.
It's not like you and when Madame now. You say, I love Madame, I love her. And she's like, no, so can you help me with this? I beg, I don't get your time. Your actions don't fit your words. Our actions, unfortunately,
don't fit our words.
Do not reflect that we value life. And let me be very, very clear. Nigeria is a very, very dangerous place to be poor. Very, very dangerous place to be poor. And which is wrong. It is not a crime to be poor. But to be very, very clear, any society, anywhere in the world that neglects the needs of the poor and the vulnerable can never succeed. Can never succeed.
I agree.
When they say what is good for the goose is good for the gander. All of us at For Birth for Life, we say every life matters. It doesn't matter who you are, prince or pauper. Your life is valued. That value, it is given by the Creator. And nothing should devalue your life. The only things, they say all men are equal. The only things that make us appear different are our opportunities and our fortunes. I am not better. Do you know the best thing that happened to me in my life?
Wow.
The best thing that happened to me was when I realized, and not only that I realized, my father used to tell me, they say, my father was a great man. My parents, my father, my mom, amazing people. Amazing people. So this man that you're seeing talking to you here is because Chief Aproko Oyefeso and Mrs. Elizabeth Adeshola Oyefeso got together, produced this guy. They produced this guy and started preparing him, arranging him, education, support, blah, blah, blah. They were responsible for me. They were on assignment. They have now produced me. I am now a product that should be an asset to society. The only value of my existence is not in what I can do for myself, what I have, what I bought, my position, my cars, absolutely irrelevant.
Mm-hmm.
My only relevance is in love and service. Very simple. My mother told me, she said, after many years of this For Birth for Life work, my mother said, Olumide, it's interesting that you are doing this thing. I was born at Atunrashe Hospital. One day I'll go there and go and even look. I don't know whether it's still there anymore. There was a popular hospital. She said that when I was born, that I was not breathing.
I see why this matters to you.
And this lady, who was the midwife, I believe she was the wife of the owner of the hospital. She said the lady grabbed me, turned me upside down, spanked me. So it worked for me, though. It is interesting that you're doing this. And that's what she said. That she remembers clearly that was what happened.
So, let us assume that a child dies in a faraway village somewhere, either from malnutrition or from secondary apnea, just as you mentioned, recorded as stillbirths.
Apnea would not kill them before hunger.
Who do we blame for the death of this child? Is it the parents? Is it the doctor? Is it the system? Is it the government? Is it the people around the person? Or does everybody share blame in this, including you and I?
So, in medical school, we used to have this objective questions, A, B, C, D, E.
Choose the option.
Choose the option.
Plus negative marking.
And then there was one option that would say all of the above. So the answer is all of the above. And too consistently, any big problem, any seriously big problem, always has a multiplicity of factors.
I agree.
It's a combination of things. But if we want, we can go a little bit deeper. Number one is government. Government has to be the quarterback of healthcare. Most successful countries struggle with the cost of healthcare.
I agree.
But they maintain the struggle.
Despite it not being cheap.
They maintain the struggle because they value life. Depending on the sources you look at, more than 80% of healthcare expenditure in Nigeria is out of pocket.
I agree.
Out of pocket. Very few people can afford to pay out of pocket for a serious medical condition. Serious. Out of pocket.
Cancer, for instance.
Yes, cancer, for instance. And then primary healthcare. Primary healthcare. Our officials need to leave all these bells and whistles. Oh, they just built this big hospital somewhere, blah, blah. I just roll my eyes. There we go.
Ultra modern center.
Oh, blah, blah, state of the art, capacity to pay. How many people can pay for it? How many people can pay for it? If you dropped on the streets here, how would you get to that hospital?
Not just the hospital, the right hospital.
Yeah. Okada, walking, keke marua, taxi, Uber. Remember, I've not said ambulance. When was the last time you saw an ambulance rushing somewhere on that street? Ambulance. Ambulance. Some kind of bus with medical stuff inside. In case something happens, it can take you to the hospital quickly. In civilized countries, it's a law. When the ambulance is moving, everybody step aside. If the fire truck is moving, everybody step aside. If you hear siren here, we they move. When we hear siren, who is moving when we hear siren here? We are still joking. We are playing 10-10 when other people are playing chess. We have not started. Honestly. So, but I don't want to miss this point. At the core of what we need is basic, solid primary health care. Primary health care. You see, in that village you're talking about, they have a good primary health care center, well-staffed, well-supported, medication, things for the community. The staff can do all the basic medical things, check blood pressure, blood sugar, certain tests. A mother can come there and deliver a simple, uncomplicated delivery. Simple, uncomplicated. They have 24/7 staff coverage. They have a connection with a higher center so that if they need advice or if there's a problem, they have a source. They are able to escalate care. They have a transportation service that can move someone to where they need care. There is health insurance. Health insurance. That's the core of what we need. Will you believe that I've seen some health centers in this country? I've seen some health centers that will shock you. Not fit for purpose.
But then again, permit me to veer on the other side of this argument. It has been shown that, where it looks like the government won't step up, most times private individuals do. And I'm a volunteer for PISHN, and that's the Private Sector Health Alliance of Nigeria, right? And they have this particular project called Adopt a Primary Healthcare Facility, where we're trying to, help the private individuals, especially understand how important it is for them to also play a part, especially in the healthcare in Nigeria, which I also think is very important. However, I do not think that's sustainable in the long run, because the government is in charge of healthcare, especially when we talk about universal healthcare, right? Do you think that we can donate an NGO our way out of this systemic mess that we're in?
So the reality is that they say, how do you eat an elephant? They say piece by piece.
Okay.
There is an absolute need for more public-private partnerships, absolute need for more NGO engagement. But there has to be a certain level of synergy regarding the things that they do. We have to reduce bottlenecks.
Yeah.
We have to eliminate rent keepers and gatekeepers. There are many places you go to where people actually mean well. They want to do good things. And there's some funny bureaucracy, some funny bottlenecks that they have to deal with. Adopt a primary healthcare center is absolutely critical. And it's actually one of the things that I'm very interested in.
Yeah.
And in some of the spaces that I find myself, I'm talking about those things. that there are many foreign countries where they'll say, you go there, they'll say, adopt a highway.
Yeah.
Let us adopt more primary healthcare centers. If you are somewhere, oh, I'm in Sabongidaora, I'm in this location, you will see those health centers that are just bent out of shape. We can renovate it. We can paint it. We can talk within the community. There are many creative ways. If we use some of the money that we are using for our serious burials, maybe instead of 10 cows, you can tell Oga Big Man, Oga, can you kill 7? So that the money for the remaining 3 cows we can use towards the health center. You know, there's so many things that can be done. And it's painfully simple. I'm a professional refugee.
Okay.
I spent my time between North America and Nigeria. And I'm one of those people who is only physically outside Nigeria. My heart beats in Nigeria. Long story short was that there was a time I worked in a remote part of America.
Mm-hmm.
I worked in Pemiscot County, Missouri, the poorest county in the state of Missouri. And at that time, I was given an incentive to work there that a colleague of mine working in New York would not get.
Mm.
If we get a youth copper, if we get a young doctor, if we get nurses, they can be given an incentive to stay in an underserved area. Give them free accommodation, top up their salary, support them, recognize them for rendering a service to the community. Everybody cannot be in Lagos.
I did my house job in a underserved area, and guess what the government did? One of the first things the government did was to remove the rural incentive. And I know what it did to the morale of the doctors, especially in that particular area. Because people like to deceive doctors that, hey, doctors have a calling. And our calling is from Most High, because we are taking care of human lives. But what we fail to realize is that the person who is doing the job also has to take care of himself. And I think that Nigerians are done with the blackmail, emotional blackmail. You know, you have a calling. No, take care of your doctors. The reason doctors are leaving Nigeria is simply because there is no incentive for them to stay here. And you always go to where your skills are best needed. You know, yes, given there are some people that are crazy too that decide to stay back. But there's this sentiment online that if public officials were to use our public hospitals, things would change. Do you agree with that?
2,000,000%.
Why?
So they say the taste of the pudding is in the eating.
Mm.
Then hear this: talent goes where it's rewarded. If we agree that we are all Nigerians, we have an equal stake in this country. If we could understand that public officials work for the public, Nigerians don't realize that the officials, the politicians, your governor, your president, House of Assembly, they work for you. The time you realize they work for you is when they come and beg for your votes. They work for us. If they work for Nigeria, they love Nigeria so much
that they're willing to work for
they are
Nigeria.
Fixing the place, making all these wonderful promises. Let us all go to the hospital here together. It's only fair. It's only fair. Amala is Amala now. A dick icon is a dick icon now. Let's all eat from the same soup. Maybe it's our soup, it's our country. And guess what? Many of them you even use public funds for international healthcare. But the reality is that we need to be very clear. We need to be very clear that we're playing a dangerous game here. Talent goes where it's rewarded.
Mm.
Talent goes where it's rewarded. For me, it's too hard for me to do that. I literally went to medical school for free, as far as I'm concerned. I did all my training here. Nigeria produced me. It would be a crime for me not to serve Nigeria. And for me, for our friends and partners and all the good people that work with us, I'm the houseboy for Bread for Life. There are some guys I'll go and report to say, Oga, don't come back. This is what we're doing now. So I'm the errand boy and I'm the spokesperson. But the point is that Nigeria gave me life. So I have an absolute responsibility to give back to Nigeria, period. But it's very easy to give up on Nigeria. Very easy. Very hard to serve Nigeria. It takes too great a conviction to serve Nigeria. Government, we shout, we like to say, but it's true. We need to create an enabling environment. I am expression of brain drain that is now an outlet for brain gain. I repeat again. I am an expression, an example of brain drain that is now an asset for brain gain. So that even though many of our people are jackpads and all of that stuff, then there should be a jackpada. If the conditions are right, Nigeria has such an unbelievable opportunity to tap into the vast potential of many of its doctors and other medical professionals who have left. But it's also important to note that in order for this to really happen, it comes back to the question, what is the value of a Nigerian life?
You've practiced in Nigeria.
Absolutely.
You've also practiced outside Nigeria. In a few words, what would be the stark difference between these two countries and how they treat their vulnerable people? What are the things we still struggle with here that are not a problem at all outside the country? Let's say in the Western climate.
So I think we're doing poorly at caring for the poor and the vulnerable.
Okay.
We're doing very poorly. And we don't have enough dignity of labor. And we seem to accept that it's okay for some people to be that way. We just seem to accept. And we have not been intentional to create enough systems to protect the poor. So, for example, I was in Makoko yesterday. An interesting story about how I got into Makoko. We got into Makoko because of a young girl named Esther, who happened to work with, interestingly, I'll say it, as Esther happens to work with Tunde Onokoya, the Chess in Slums Africa man.
Yeah.
By the way, I love what that man is doing.
Incredible work he's doing.
I love what he's doing. It's just fantastic to me. And if everybody knows him, Tunde Onokoya, I'm a fan, number one fan. But, so I reached out to them. I like what they're doing. That there are ways for Bread for Life can work with them. So some of these people contacted them and we just started the conversation. Because it's good for the good people doing these things need to connect. We need to grow the army.
Yeah.
We need more soldiers in the army.
Right.
As the Christians will say that we need more laborers to the harvest. Not everybody can do it. Let's be clear. Very few people are crazy enough to do it.
Yep.
But let the crazies find themselves. Stop doing solo acts. It does not work. This matter is bigger than any one entity.
I agree.
I tell people that as Nigerians, oftentimes we're individually brilliant, but collectively mediocre. And because we're collectively mediocre, the individual brilliance becomes irrelevant.
I agree.
We never have electricity, but you're bragging because you have a big generator. You're not thinking well. We need to solve our communal electricity problem. But I digress. Esther works with Chess in Slums, one of their program coordinators. And as we're talking about we can do and all that, and Esther tells me that, oh, Doc, there's some pregnant women dying in Makoko. I said, sorry, come again. She said, yes, we've been losing some pregnant women from childbirth. And I said, Esther, we need to talk about this. And she explains to me. I said, how do you know this? She said she grew up and lives in Makoko.
She was born there.
Born there, raised there, lives there. And I made a promise to Esther that we are coming to Makoko. Okay. And we went to Makoko yesterday.
What was your experience?
Hi!
What single experience stood out to you?
No, single will not do it justice.
Let's try single.
So, the conditions are really tough and deplorable. Right here in Lagos. Not some far place, in Lagos. If you get on Third Mainland Bridge, you look to your right. If you're coming into Third Mainland Bridge, it's there. Right here in Lagos, that people are in this situation. The water is filthy, filled with refuse. There is feces in the water. What we call sheets. Sheets, they the water. Some children are swimming in the water. Some children are swimming in the water, but children everywhere. So many children. High birth rates in that place. Not much to do. No Netflix, no this, But anyway. What was interesting about these children? Children are just amazing. The best of humanity. Extremely happy children. Happy and excited. And I'm like, wow. Those children got me thinking that, just quickly, we have some children that are, children of rich people, comfortable families, that they are not as happy as those children. I started writing an article this morning. I'm working on it. And I realized some of the reasons why. But anyway.
Do they have a hospital there? And did you visit?
So I went to visit a health center there, a clinic there. And, the conditions are too poor. They're too poor. And we want to work with them to make some changes there. We met some ladies there who had just delivered their babies. 4 of them.
4 women.
4 women. The cost of delivery at that place is 25,000 naira. Normal delivery. 4 of the women could not go home. They were there with their babies because they owed the establishment money. The 4 of them owed a combined, 4 of them together, owed a combined total of 70,000 naira. 70,000. Not 7 million, 70,000 naira. 4 of them owed 70,000 naira. Now, their monies were not equal. There was one that was 30,000, one was 20, one was 15, one was 10. Total 70,000 naira. And we told the proprietor of the place, we said, just like in the Bible, when they told Pharaoh, let my people go. And we paid for them, tell them to go home. And to be honest, during the experience, I cried during my time there. Nobody should live like this. No human being should be in this situation. This is not right. Yes, we can fix everyone. We can't save everyone.
Yeah.
But according to the words of Ellen Keller said, I cannot do everything, but I can do something. Because I cannot do everything, I will not refuse to do that something that I can do.
Have you ever had to beg the public for donations for a child?
I'm a professional beggar. Have I ever? That's all I do. We beg all the time. All the time. And for me, it's easy.
Do you think people are more inclined to give to people in help who need help?
And we need help. I think our people can be compassionate, but sometimes it's challenging. So like for us, part of what we noticed that because we raise funds to train healthcare providers, for example. So we want to raise funds to train healthcare providers. Some people respond, but a lot of my friends and family, I'm sorry for all I've been putting you through, but it's for a good cause. My friends and family, they know you can't spend 20 minutes with 1 hour with me without getting into this because, and it's not just because it's very simple for me to do in the sense that all of these things, somebody's life depends on it. This is not just a conversation.
I agree.
Somebody's life
depends on this conversation.
Depends on this conversation. That is how powerful it is. We all know about the the butterfly effect, ripple effect. So who am I not to beg? I will beg anyone.
Which leads me to my next question. How many lives would you say for Breath for Life has impacted since it was incepted?
I really couldn't count, to be quite honest.
If you were to give a random number off the top of your head, doesn't have to be accurate.
I would say in the millions.
From just training the providers.
Because we train providers. Sometimes we do run health clinics. We've done open heart surgery. There are children in this country that cannot afford open heart surgery.
Yeah, of course.
They're talking excess of 8 million naira for one case to be paid out of pocket.
Where you currently practice, are there people who get those kind of services without going broke?
Absolutely. Because the system is designed to cover that.
So you're saying that where you currently practice, children can get open heart surgeries without the parents going broke?
The parents, no, it's not a matter of the parents being broke. They will not pay $1. They will not pay $1. A friend of mine, his kid got a diagnosis of cancer. Just long story short. Got a diagnosis of cancer. He's a doctor, by the way. Illness does not respect anybody.
Yep.
Illness does not say, this is Dr. Chinonso's son now. As they say that time, now staff now. We can't mess with staff now. Illness is a leveler. The son got diagnosed with cancer. Treatment, bam, 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 bam. Everything like clockwork. 90% of his treatment was covered within the healthcare system. Okay? The government funded healthcare system. 90% covered, and then the parents pay 10%. That 10%, there is a foundation whose sole purpose is to reimburse the 10% to the parents.
I see what you're saying.
The kid is playing, running around. Things like I think boy's like 12 years old and or not running around. You wouldn't know anything happened to him. You wouldn't know anything happened to him. My last child, my 10-year-old boy, after we had him, before that we had 3 girls. So you know how we behave. Oh, finally the boy and all that stuff. And okay, for the pregnancy, we didn't, I insisted that we wouldn't know the sex of the child until the baby was born.
Okay.
And then the baby came out. I just quickly looked between the legs. I was like, it's a boy. Okay, great. And then I looked. My colleague, the obstetrician, was not smiling. My wife was bleeding. She was bleeding. Within 30 minutes of my son's delivery, my wife was back in the operating room.
Postpartum hemorrhage.
I was sitting down there. They put her to sleep. Like 8 medical staff running around the room, anesthesia, they're running around the room.
For context, that's actually something that kills a lot of women in childbirth here in Nigeria.
Absolutely.
Postpartum hemorrhage. One of the biggest causes of death for pregnant women.
I will say a sentence about that maternal mortality thing.
Yes.
So it was remarkable. Everything that needed to be done was done. My wife is alive. My son is alive. And as I thought, every time I reflect on that experience, I ask myself, if we were in Nigeria, what would have happened? When I look at her and look at my son.
For context, there are actually well-equipped hospitals in this part of the world.
Absolutely.
The problem is it's not evenly distributed.
Who can pay?
Exactly. So it's gathered around the people who can pay for it. Who can
pay. And even those who can pay don't find it easy. And there are many people doing good work in Nigeria, to be very clear. There are some good hospitals in Nigeria. And I know many of these people. And it's not easy for them to keep their doors open. It's not easy. When they say, doctors are supposed to be compassionate and it's the calling and all that. They have to pay for electricity.
Agree.
They have to run the place. They have to buy medical equipment. They have to pay for staff, pay for medication, everything. There's nothing inside the hospital that is free. Nothing.
It's not cheap. It's not cheap. Somebody has to bear that cost.
Healthcare is not free. Somebody has to pay for it. So if you say doctors are turning people back, not because they're trying to be mean, but if nobody pays, that place is going to be shut down. Now, and one of the things I must say, for Bread for Life, a couple years back, we started partnering with the Paediatric Association of Nigeria and the Nigerian Society of Neonatal Medicine.
I was there at the last conference.
Yes.
Quite enlightening.
Oh, we still have wonderful doctors in this country. And we are so happy and proud to work with them that there has to be a bridge between those who have left and those who are left.
Yeah.
There has to be a bridge. I like that, Iran. Between those who have left and those who are left. We are all on the same page. We need to be working together. Maternal mortality.
For those who have left and those who are left, I know there's AMPA, for instance, trying to bridge that gap.
Absolutely.
They were at Butemeta last year.
Absolutely.
Sorry, a few months ago, actually. A few weeks ago.
Yes.
Free surgeries, training. So yes, it's always nice to see collaborations and, objectives like that are able to at least try as much as they can to bridge that gap.
Let me tell you something interesting. So, of course, we're quite connected with AMPA. And that's part of what the gospel that we're preaching, that we need to work together.
Yeah. So,
during the conference for AMPA also, during their conference, does the training for healthcare providers. And for Bread for Life, we're able to donate ambu bags towards their training.
Do you still have hope for the Nigerian children, or is that hope fading?
Yes, I do. Yes, I do. What are we without hope? But it's not a blind hope or a blind faith.
Mm-hmm.
We have to be intentional about it.
Yeah.
Absolutely, I do. Because I get encouraged every time. Because if enough good people do good things, many things will change.
I agree.
If enough people speak the truth, many things will change. If enough people demand some more accountability, many things will change. Absolutely. Absolutely.
Thank you so much. You've heard it all. From a doctor who sees it every day, to a system that's failing our children, from a country that keeps looking away. But you're not powerless. You can ask better questions. You can demand more from those in power. You can make noise that forces change, because silence is also part of the problem. And these children don't have time. So subscribe, like, share this video. Just keep ensuring that it gets to the ears of the people who are supposed to hear it. And until next time, I'm Aproko Doctor, and this is Unclog.